Oh, I should do it here too.
Yeah.
Press record. Go ahead.
I am Toby Williams, CrossFit Level 1, CrossFit enthusiast. General knowledge of some things fitness.
PhD in CrossFit. I'm Hannah Whitfield, and I am currently a nursing student. I've been doing CrossFit for about 3 years. About a month ago, I had a mishap with a snatch and fractured my C6. Was out for 3 months in a neck brace, and am recovering from that. And I love Jesus.
I do too. So there's been a lot of talk about the new regional stuff, and a lot of people are talking about that, but we want to kind of focus on the CrossFit health portion today and kind of give our take on where that's going, as opposed to just talking about CrossFit regionals, because regionals is only a small part of CrossFit's mission.
Well, actually, regionals is no longer a part of CrossFit's mission.
Well, the CrossFit Games, according to Glassman, are a small part of CrossFit's mission, because he does not want people to get the impression that all of those aspects are what CrossFit is about. CrossFit is about health and wellness, not about the 1% that make the games.
Exactly. Like, my dream goal with all these changes in the game stuff, of course, I would love to be, dream a professional athlete. But I'm in nursing school right now, and looks like I'm going to be a professional nurse before I'm anything else. Which actually, with these new changes, might be pretty good for nurses.
Yeah. They're doing a lot with doctors and doing the level 1 seminars for doctors, and I know they just recently had one, and Julie Fouché was a big part of that, and it seems to have been a success. They had people from all over the world come over and take the CrossFit Level 1 class to kind of include in their regimen. But nurses are so prevalent in hospitals and doctors' offices and so many other healthcare professions that I think it would be a good idea if they started doing that with just nurses in general. I don't know how they would pick the nurses that would choose to come, or if it's like an open enrollment thing, but because nurses are just so prevalent with patients, I think that it would be a good idea for them to have that option to help give patients an idea of what it means to work on their health and fitness.
Yeah. Well, I know there'd be a lot more nurses there, because there's 3 times as many nurses as there are doctors. So it might be a little bit harder to do that at the ranch, because there's so many nurses. But there's also so many more nurses, so there's that many more people that you can use to impact these people and infiltrate the healthcare system.
Well, if they did do the nurses, they have so many other places they do the level 1 at. They don't have to go to the ranch.
True.
Chuck Carson, who was my level 1 main instructor, is very good level 1 instructor, and all of those people that they bring in to do those level 1 seminars are very knowledgeable and know how to go through the different foundational movements you're going to be using, in CrossFit, and that you use in everyday life.
But it's still pretty cool that they get to go to the ranch, and I'm a little bit jealous.
That's pretty cool. Anybody that gets to go to the ranch is pretty cool.
But the nurses, they are the ones that our job is to protect and to educate. When I have these test questions, if there's one about teaching the patient something, that's going to be the right answer, because that's what they're drilling into us is education, patient safety, patient education.
Well, going through, I guess the program again, since you had to withdraw when you hurt yourself.
Right.
Do you feel like in the future they're going to start including test questions that are more prescribing health and fitness than prescribing a pill?
Probably not. Right now we are learning all about medicine and the effects medicine has, and how when you take medicine, this can happen and this can happen, and we're learning all these side effects, and we learn about the bad effects of immobility, but we aren't learning anything about the good effects of exercise and proper nutrition. We're just learning all the bad stuff about it, about what happens when you don't have it. Yeah, there's not a lot of that kind of education. It's more like, oh yeah, if you take this pill, you should watch out for bleeding, because you might bleed out.
Well, with the amount of, just to touch back on the Open for a second, with the amount of doctors and nurses that participate in the Open, maybe that will change, because there were, roughly about 5,000 doctors and 8,550 nurses worldwide that participated in the Open, and I think that number has started to increase every year. So along with, an Open participation and them seeing the effects of how health and wellness can help you be a more well-rounded, not only person and athlete and possibly doctor and nurse, maybe that will convince them to maybe bring that to the teaching curriculum as more nurses and doctors are coming up through the field, and kind of letting them know that prescribing exercises, range of movement, things of that nature are going to be just as beneficial to your health as taking this pill to lower your blood pressure. Because once you do the work, you don't have to take a blood pressure medication. You can regulate that yourself.
Yeah, and the way our healthcare system is set up right now, it's going to be easier to change it from within with these small changes from the doctors and the nurses than it is to, because you think about how long it takes to write a nursing school book or a med school book and all that stuff. Like, to rewrite a program, it takes years, and to implement that program, nursing school is 2 to 4 years, or so it's going to take that long to make those changes. But if you can make those changes within, it's going to be a lot more organic and faster too.
Yeah, I know there's a hospital in Albany that incorporates CrossFit into their actual hospital itself. There's a gym within there so that not only people outside of the hospital can join, but the staff themselves have the option to actually do CrossFit for health and wellness within the hospital that they work at.
That's not the one that Julie Fichet just interviewed about, was it?
Was it the Phoebe Putney?
I don't think so, but that's pretty cool.
Yeah,
I would love to work at a hospital like that.
Yeah.
Or just,
The owner, I believe, he was a former athlete at one of the other gyms, and I think he was a nursing student as well, and transferred that over to opening up the gym within Phoebe Putney. I don't know that for certain. That's not solid facts. I just think that's how it went down.
Well, I'm going to have to probably get up with him and ask him some questions about that, because that is quite interesting. Yeah. I was just looking at the CrossFit Journal, where it was like a year ago in 2017, and they put out the Healthcare Revolution, and how it was kind of telling box owners how to incorporate nurses into their mission, and how to get nurses into their box, and how once you get the nurses in your box, how to relate to them, and how to tell them about the sickness wellness continuum, and how to tell them about just the way CrossFit is, and what our goals is as CrossFit, and how nurses can have a part in that, and then how nurses want to be educated as well. They want their opinions valued, and it was kind of going into how you could do that, questions to ask them and stuff like that. And I would think that with this games and regionals changes, that you would have seen more of that, and I don't think we're seeing that, and I don't know if that's where Coach Glassman was going, but I really wish that we saw more of that, because for someone like me, I want to do my part and I want to help, but I'm not really sure how right now.
Yeah, because I know as a student you probably don't have a very big voice in anything, but as far as nursing goes, once you start your career in nursing, do they have a lot of opinion that is listened to within the hospitals or doctors that they work with, because they have so much patient interaction?
They don't have a whole lot. They do have some, and at least, you have a little bit more autonomy when you're not a student, because then you can have, you have your nursing diagnosis and your interventions, and your interventions can be exercise and nutrition related instead of medicine related. So your focus can be, when you go into the patient's room, here's your blood pressure medicine. These are the side effects, but also you're having this blood pressure medicine because of this, this, and this. If you wanted to improve this, this is what you could do. You get to have a lot more patient interaction and patient education if you're an actual nurse instead of a student.
So with the stigma that always surrounds, starting CrossFit, you have to be, or people, you don't have to be, people with the opinion that you have to be in shape to start, or they see what's on television and they're like, oh well, I can't and I can never do that. Or they hear the bad reviews where people are like, oh well, you hurt your knees or your shoulders or your rotator cuff by doing certain exercises. Do you feel like, if nurses were able to go through that level 1 like the doctors, or would they be in a better position to help the CrossFit culture and kind of erase that stigma, to let people know, hey, this isn't what you see, and these are dynamic movements that anyone can do. What you see here isn't what you're going to do, and the injuries that you may have or concerns you may be dealing with are things that the coaches are trained to help you with to get around those issues.
Yeah, if you saw like your average doctor and someone that wasn't like a CrossFit enthusiast, but someone that was, or your typical CrossFit enthusiast, someone that was, goes to the gym a normal amount and does it for their health and wellness, especially if they were a doctor or someone in the healthcare profession recommending that to you, it would have a lot more meaning to it, I guess, because, if you have some meathead saying, yeah, CrossFit is awesome, you're going to be like, yeah, but you work out 3 times a day and you're a little too muscular for what I'm going for.
Yeah. I've had that conversation with people before, and I think a lot of people, like a lot of my friends, forget that when I started, like, I wasn't in shape.
Yeah, we had this conversation with someone at church this morning.
Yeah, I was like 260, 38-inch waist. I couldn't run 200 meters. I was a big dude. So, when I started, I really didn't know much about it other than, my brother had taken me to a class about a year prior to me starting, and I did not do well, kind of quit. But when he moved back to our hometown, he opened one. He basically approached me and said, hey, so you're going to get in here and get healthy. You don't really have a choice. So you can either show up on your own, or I can come get you until you start showing up on your own. And you'd be surprised that, once you get in there, it's hard. Like any exercise program you start is hard. But you'd be surprised about what you can do with a group of like-minded individuals pushing you to be a better person.
And I guess people don't see the Miss Sharon Austin. I hope you don't mind me saying her name out loud, but she's not my age, but she gets in there and she does her deadlifts and she rocks it. She gets down, does them burpees, and she does it. And people are like, oh, I'm too old for that, and they're younger than Miss Austin. And I'm like, no, you are not too old. Or they're like, oh, I'm not strong enough. And I'm like, no one's ever going to be strong enough to start. So
yeah. And I've come from 2 different gyms before, just kind of doing my own thing in the garage. So I've seen, 14-year-olds through, I want to say, mid to late 60-year-olds at the last gym I was at, going through and doing pull-ups. They've never done pull-ups before, and doing, 4-range of motion squats they thought they couldn't do because, they felt like their knees, their hips were too far past that, or, just people on their own weight loss journey being able to perform these movements that, in their mind they can never do. But once you get in there around these people that are really feeding you this positive energy, being able to accomplish these things. And that's one of the biggest, I think, draws that CrossFit has, is they have that that group dynamic atmosphere that, you know, people like to joke that CrossFit is, you know, such a cult with what we talk about, but they haven't been in there to be, you know, have a circle of 5 to 8 to 10 people around you when you're in the middle of trying to do something that you've never done before, and having the entire gym just erupt when people cheer for you, and just
Literally.
you get this rush and this feeling of, wow, like I did it, and these people care about me and my health and my fitness, and that's, you know, such a great feeling. And it's, you know, being a competitive CrossFit person and being someone that's also used it for health, it's definitely nice to see CrossFit taking such an approach to the health side of it. I mean, I'm not gonna pretend that when it first came out, I was just like, wow, you know, the competitive scene, that's gonna be like, you know, awful. And we can talk about that another time, because my opinion has changed on that. But it's nice to see them so focused on health and wellness and trying to do these things to like make people understand that if you will just, you know, get in the box, get with a coach, and let us start working with you, you know, we can change your life.
Yeah. And I think people also forget that those people that they get their first pull-up, they didn't come in the gym doing pull-ups. They came in the gym and they started out with a scaled workout. I mean, I scaled workouts for I don't know how long. Sometimes I still scale workouts. And people forget that, like, and they don't even, not that they forget, but they might not even know that you can scale CrossFit to literally any skill level. Like, I don't think people even know or understand that aspect of CrossFit.
Yeah, and there's a lot of media I think CrossFit's put out in the past probably 6 months as they've been more focused on this health initiative, where they really try to showcase the large weight loss. You know, people that have lost 100 pounds in a year by being consistent in the gym and with their eating, and people that are, you know, in the geriatric age, that there are classes that people in gyms specifically make for them, and they just have super scaled down movements, but the purpose isn't to make them a CrossFit athlete. The purpose is to make them move. And once you move and you get your body back in a position of normal squatting, normal, you know, walking or running or just moving in general, your overall health just begins to rise, because that's what your body needs and what your body is used to.
But they're athletes too. They're doing the sport. I mean, just like when you play baseball, if you play t-ball or if you play Major League Baseball, you're still an athlete. And so these geriatric age old ladies that are stepping on plates instead of jumping onto a box, and they're holding on to a rail to keep their balance. But then if they keep doing that for another month, they're gonna be able to step on to that box without having to hold on to anything for balance. And then they're going to be able to climb up steps to their house or to their church without having to hold on to the rail. They're going to be able to just live like...
You know, and as, you know, and it makes the transition to an older age so much easier when you continue to be active and moving, because once you become sedentary, it is very difficult to not be sedentary.
Right.
Like once you hit that certain age, I mean, it's very easy for your body to just get used to not doing a lot, and then you start losing the ability to squat well or bend over, and, you know, joint pain and discomfort that come with just being sedentary and allowing your muscles to just waste and fatigue.
And that is the long-term goal of CrossFit, is to keep you out of the nursing home, keep you at home in your house, being able to do your own activities of daily living without someone having to do it for you, and just being pumped full of medicine and have someone feed you and
wipe your own butt.
Yes, you can wipe your own butt when you do CrossFit. I think we should end on that.
Okay.
Do CrossFit so you can wipe your own butt.
Yep.